Okay, so we will go back to pharmacology, but I really enjoyed the previous presentation since I am not from this field. I always consider there are 4 pillars against Alzheimer's disease. One is education, the second one is social life, and this was particularly illustrated in the previous presentations. The third one is activity, sports, and from the preclinical point of view, when we breed animals in an unrich environment with congeners, in a complex environment with activity wheels, with the main impact is due to the activity wheels and the fact that animals have more exercise. It's much more important than the fact that they are breeding groups. So in the preclinical stage, the activity is maybe the most important pillar. And the last one, of course, is food, the way we eat. I would like to take this opportunity to speak today to present you a new target that is studied because it has some neuroprotective activity in the brain, particularly because one drug is in clinical trial now, and we are expected the data next year. So you know, Alzheimer's disease and the toxicity induced in the brain during the course of the pathology is particularly complex. It involves oxidative stress, neuroinflammation, cellular stress, ischemia, apoptosis, parthanatos, DNA damage, and all these events are interrelated and concurs to the synaptic damage, the cell loss, and finally the learning and memory deficits, which will develop until dementia. We have already spoken about the 3 main hallmarks of the pathology, the extracellular deposits of aggregated amyloid beta protein, which clearly makes senile plaques. My view is that senile plaques is more a scar in the brain than a toxic process. What is very toxic is oligomers, the soluble oligomers. And the brain found this way of doing senile plaques to try to limit the toxicity induced by the soluble species. We have also a problem intracellularly with the appearance of neurofibrillary tangles, the fact that tau protein is hyperphosphorylated and start to aggregate in a similar process as A beta, and this will make the neurons die from the inside. And mitochondrial dysfunction seems to be a very, very important phenomenon also. I consider Alzheimer's disease as a mitochondrial disease. And it must be the target of effective neuroprotective strategies. There are several risk factors. Age, we know that it's a pathology of aging. Sex, women develop more the pathologies than men. There is a comorbidity, particularly in patients with Down syndrome, because on the chromosome triplicated in Down syndrome, there is APP, there is presenilin 1, so the condition to develop Alzheimer's disease. And in terms of genetic risk factors, the most established one is the fact that people expressing the allele epsilon 4 of apolipoprotein E have more chance to develop Alzheimer's. But clearly there are deterministic genes, and mutation on these genes have defined what we call the family forms of Alzheimer's disease. Very interestingly, there are several studies now showing that another protein, the sigma-1 protein, can show polymorphism, and this polymorphism, at least in 3 studies, have been demonstrated to be protective against Alzheimer's disease. And particularly, the 2 first studies suggested a link between the sigma-1 protein polymorphism and ApoE epsilon 4 polymorphism in decreasing the risk to develop Alzheimer's disease. So what is this sigma-1 protein? It has been named sigma because 30 years ago it was identified as an opiate receptor, mu for morphine, kappa for ketocyclazocine, and sigma for SKF10047. So the effect induced by sigma drugs were compared to or considered as opiate effects. It was in fact clearly identified as a non-opiate receptor, and it has been almost recently, 10 years ago only, identified, cloned, and its cellular role has been established. It's a 223 amino acid protein, which has absolutely no similarity with non-mammalian protein, but a high conservation among tissues and species. It's expressed in a lot of organs. For example, there is no red in this projector, but so this is a whole body imaging, and the sigma receptor is very expressed in the liver, in the brain, in the gonads, in the lung, but also in endocrine glands, in intestine. And in each organ, it's expressed in a variety of cells. In the brain, for example, it's expressed in neurons, astrocytes, microglia, oligodendrocyte, and Schwann cells. So it's a very ubiquitous protein. Its structure has been defined, but the receptor is not, the protein is not crystallized yet. And in the cell, it's present on plasma membrane, on the mitochondria, on the endoplasmic reticulum. The picture that makes helps to understand what we know about the role of this protein in the cell has been published in a review paper in Trends in Pharmacological Science. So the sigma receptor it's in red in the original picture. It's this protein, and its main location is on the endoplasmic reticulum, facing the mitochondria, even on focal contact points between the endoplasmic reticulum and the mitochondria. It chaperones IP3 receptor, which gate calcium mobilization from the endoplasmic reticulum to the mitochondria, so it helps to preserve the mitochondrial integrity and functioning. But it also chaperones very specific protein like BIP, which are sensor of the endoplasmic reticulum stress. So when the sigma-1 protein is activated, it will help the mitochondria to function. It will help the endoplasmic reticulum to respond, for example, to the accumulation of malconformed protein. And in case of overactivation, it can also migrate to the plasma membrane, and there it can interact with a lot of transmembrane receptors, a lot of ion channels, so it can facilitate the signaling pathway induced by post-membrane receptor, postsynaptic receptor. So it's a case of a G-coupled protein receptor. It's a case of an NMDA receptor, trophic factor receptor, BDNF receptor, for example, and it also modulates several ion channels, so clearly modulates the homeostasis of the cell. In fact, in the clinical use, presently, there are several compounds that have a sigma-1 activity. The first one and most important one in our interest today is donepezil, Aricept. It's not only a cholinesterase inhibitor, but it's also a sigma-1 agonist. On the request of ESI, we published a paper showing the sigma-1 activity in donepezil effects. To do that, we injected ICV in the ventricle of mice, an oligomers of A-beta 2535, and this allows after 1 week to have a pharmacological model of Alzheimer's with all the characteristics we found in the Alzheimer toxicity. Particularly, animals have very strong oxidative stress. This is, for example, the measure of reactive oxygen species in control animals and after A-beta 2535. When you inject donepezil every day during the week the toxicity develops, you will see a protection by donepezil against the oxidative stress, exactly the same as with a selective sigma-1 agonist, PRE084. And when you co-administered a sigma-1 antagonist, it blocks partially the effect of donepezil, completely the effect of PRE, and it has no effect by itself. And when you compare with other cholinesterase inhibitors, they induce some protection, but of course it's absolutely not involving the sigma-1 receptor. When you change the administration protocol, you inject the drug before A-beta and nothing during 1 week. The oxidative stress is still prevented by donepezil and PRE084, and in this case, the antagonist, sigma antagonist, block all effect of the drug. So in this administration procedure, donepezil behaves as a pure sigma-1 agonist. And in this condition, the other cholinergic cholinesterase inhibitors, tacrine, rivastigmine, galantamine, have no effect. So we can find preclinically in a mouse model of acute Alzheimer's disease toxicity conditions where donepezil is a pure sigma-1 agonist. And through this activity, it's protective. The second compound you may know is fluvoxamine. Fluvoxamine is a selective serotonin transporter inhibitor, which is a very strong antidepressant. And in fact, it's acting partly through the sigma-1 receptor. Among all the antidepressants, fluvoxamine has the highest affinity with 36 nanomolar. And there are a lot of studies showing that part of its clinical activity, pharmacological activity, involves the sigma-1 receptor. And even some researcher like Kenji Hashimoto in Japan makes a lot of reports describing the particularity of fluvoxamine, particularly as compared to other antidepressants like sertraline, for instance, and explaining that the difference in the pharmacological profile of the drug comes from its sigma-1 activity. So the idea to target the sigma-1 receptor in Alzheimer's disease came from several observations. The first one is the fact that we know for years, the first studies here are from 91 and 94 for my team, that sigma-1 agonists are anti-amnesic drugs. We used a lot of amnesia model in mice, pharmacological model or age animals, and every time we could get a very strong anti-amnesic effect. And in AD-like model, for example, we inject A-beta in the ventricle of the mice, and after 1 week, we inject the sigma-1 agonist before a memory test, we will see a recovery of the amnesia. In vitro, in cell culture, an Italian team described that PR084 or MR22, which are two selective sigma-1 agonists, can protect against the toxicity induced by this fragment of A-beta, A-beta 2535, in rat cortical culture. The death induced by application of A-beta can be highly significantly prevented by the compounds. And this is accompanied by a blockade of the release of BAX, which is a pro-apoptotic protein signing the toxicity. So we started to examine the neuroprotective activity of sigma-1 agonists using PRE084 as a selective reference drug with a very good affinity, nanomolar affinity for sigma-1 protein. And in collaboration with Anavex Life Science, we used 141 and 273, which are mixed muscarinic and sigma ligands. So they have a very particular pharmacological profile. 141 has nanomolar affinity, 273 micromolar affinity. When we inject these compounds before A-beta and check the memory ability of the animals after 1 week, we see a recovery of the A-beta induced deficit with the compounds. For example, 141 is able to highly significantly block the spatial working memory deficit that we measure in mice by a very simple test. In a Y maze, we place animals and measure their exploration pattern. They will get out of the first arm, enter the second one. When they came out of the second one, they will involve their working memory to remember which arm they came from and explore the third one. They will do alternations. And we just have to measure this percentage of alternation, which is close to 70% for control animals, and it drops if animals have working memory impairments. This is the case in A-beta treated animals. And you see here that the pre-administration only once before A-beta, 7 days before the test of the sigma-1 agonist, allows to completely block this deficit. We take the same animals and we use another test which will measure a completely different memory, a non-spatial long-term memory. It's a passive avoidance test. It's a cage with a grid floor, and there is a wooden platform at the center of the cage. We place animals on the wooden platform. Spontaneously, it will try to explore the cage, step down. When the 4 paws are on the grid, it receives a very small but sufficiently aversive electric shocks. So when we place again the animals 1 day after, 1 week after, it will never step down. This is the case, for example, for control. You see that 50% of the animal hairs remain 3 minutes on the platform on the deficit induced by A-beta injection. And again, we have a highly significant blockade of this deficit with the compound. Very interestingly, this dose response curve show that the active dose is about 100 microgram per kilogram, and this is very low. If you compare with PRE084, the active dose is about 1 milligram per kilogram. If you compare with a compound which is a selective muscarinic agonist, which has almost the same affinity as ANAVEX 141, the active dose is also 1 to 5 milligrams per kilogram. So the fact that the compound acts at the muscarinic and sigma protein at the same time induces a very clear synergy. It's very easy to understand because the acting at the muscarinic M1 receptor will induce a protective pathway, which is linked to the activation of M1, PLC, PKC, and mobilization of calcium from the endoplasmic reticulum. And the fact that it also acts to the sigma-1 modulatory protein, it will boost its coupling with the J protein, boost the PLC activity, boost the IP3 receptor activation. So we have a molecule which is at the same time the effector and modulator of a neuroprotective pathway, so it's very active. So we made a lot of measures to demonstrate that these compounds are neuroprotective, particularly after the behavior. We take the brain of the animals and we check the cell loss in the hippocampus. We check the neuroinflammation, the astrocyte and microglia activation. We check the oxidative stress, we check the cellular stress. And every time we see an induction of the parameter, for example, here the astroglial reaction showing neuroinflammation after A-beta, there is a prevention by the compound. Interestingly, in this model, we can also look at another aspect of Alzheimer's disease, the induction of tau phosphorylation and the abnormal phosphorylation of tau. These results are Western blots with 88 or 8100. 88 is an antibody looking at tau phosphorylated on its physiological epitopes, and this is increased in Alzheimer's disease. This is increased in our A-beta 2535 model. And 8100 looks at tau phosphorylated on pathological epitopes, and this is also increased in our model. And if you look at the effect of ANAVEX 273 or PRE084, we could see a complete blockade or significant attenuation of the induction of tau phosphorylation. This is particularly interesting because it seems to be active on the amyloid and tau at the same time. To demonstrate that the sigma-1 protein is not only a target for therapeutic intervention, but is putatively an endogenous neuroprotection systems, we try to examine the development of the AD pathology in animals where the sigma-1 protein has been invalidated. So we crossbreed sigma-1 knockout mice with APP Swedish mice, so the TG2576 line, animals that overexpress human APP with the 2 Swedish mutation, one of the historical transgenic model. And we created the APP Swedish sigma-1 knockout mice. What was very clear first was that during the year of breeding of the animals, there is absolutely no death in control animals. There is some death in the sigma-1 and APP single transgenic lines, but in the double transgenic lines, we lost a lot of animals. Only 40% of the animals survived after 1 year. So clearly there is a pathological process occurring. When we check every 2 months the cognitive abilities of the animals, for example, by just doing this very simple and very simple test, which does not impress the animals too much because it's free exploration in a safe environment. You see that in control animals, alternation percentage does not evolve. In the APP animals, it starts to progressively decrease very early at 6 or to 8 months of age. There is some deficit also in the sigma-1 knockout mice, and this is due, we know that from the phenotyping of these animals, to a deficit, an age-related memory deficit in female animal. But clearly, in the double transgenic animals, we had some deficit that are almost seen from the beginning of the life of the animals. And when we do a very classical memory test in these animals, the place learning in the water maze, so we have a very big water maze. There is a platform in some space of the maze, and animals have to use their spatial memory to use extra maze cues on the room to learn the platform location. So we do free training swim per day during 5 or 6 days. And after 1 or 2 days, we check using a prop test. We take out the platform and we measure the time spent in the quadrant of the pool. We check the quality of this reference memory. And we see, for example, look for female, almost no deficit in acquisition between the control animals and the single transgenic, but for the double transgenic animals, a very strong deficit. And when we look in the prop test, only the double transgenic animals, male and female, show a very strong deficit in learning as compared to the control. On the contrary, on this same animal, the APP Swedish mice, we have activated the sigma-1 receptor to confirm that there is a protection. So we make animals at 10 months of age drink Anavex 273, 3 milligram per kilogram per day in the drinking bottle. And we check their ability after 1 month of treatment, 2 months of treatment with the spontaneous alternation in the Y maze. And you see that at this age, animals have a very strong deficit, and this is attenuated by the compound. And again, in the water maze, at 12 months of age, animals do not learn anymore the platform location. And you see here in blue the transgenic animals treated with Anavex 273, they recover a very good acquisition. So we have done with these animals a lot of biochemical assays to measure the different aspects of toxicity. I just show you one data. We measured ROS to identify the oxidative stress. So at 8 months of age, for the double transgenic animals, there is no deficit in sigma-1 knockout or in APP animals, but there is an induction of oxidative stress in the double transgenic. And at 12 months of age, there is induction of oxidative stress in the APP animals, and this is blocked by the sigma-1 agonist treatment. So we have a clear black and white, facilitation and attenuation of the toxicity in these two parallel studies. One important aspect was to see if we have not only a neuroprotective effect of the sigma-1 agonist, but also a putative disease-modifying effect. For this, we must decrease tau phosphorylation, and we had some evidence of that in the A-beta 25 model, as I showed you, but we must also decrease the generation of A-beta 42 from APP through the beta and gamma secretase pathway. In the A-beta 25-35 model, we have an induction of A-beta 42. Clearly, the toxicity we have in this model is due to the peptide we inject, not to A-beta 42, because the induction is very limited. But the treatment with an Anavex compound clearly decreased this generation of A-beta 42. So we were very, very happy, and we wanted to reproduce that in the double transgenic animals. And unfortunately, when we look at soluble or insoluble A-beta 42, we see an induction in the transgenic animals, male or female, and we see no change in the double transgenic. We expected an amplification. And when we treated these animals with the Anavex compound, we also see no decrease in the A-beta load. So we could not confirm in the transgenic animals that sigma-1 agonist could decrease A-beta load. But this is not the reason for Anavex, because Anavex wanted to develop this compound as at least a neuroprotective drug. So they started a clinical trial. The trial is in progress in several centers in Australia. And they choose, I will not detail the clinical trial itself, but they choose two phase 2A, 2B, with an open reading frame. So they can, in fact, take information very regularly and adapt the dose, adapt the number of patients at several stages of the trial. The first data that have been released in the AAIC meeting in Washington in July clearly show that among the readouts, which are MMSE score and P300 level, so they take electroencephalogram for the patients, and they look at the change in P300 wave. And as compared to placebo-treated patients, donepezil response, the first data they get with Anavex 273 are very positive. That's a very good sign in the beginning of the study. So we will have the chance to have other data very regularly, but clearly this kind of compound, the sigma-1 agonist, may be effective, at least on symptomatic readout. So to conclude, the sigma-1 protein plays an important role in cellular homeostasis and plasticity by regulating several signaling pathways on organelle integrity. The sigma-1 inactivation amplifies amyloid toxicity and related memory deficits. Its activation prevents A-beta toxicity and related memory deficits. This observation confirmed the role as endogenous neuroprotection system played by the sigma-1 chaperone and the neuroprotective potential of sigma-1 agonist. And as shown by the Anavex example, non-selective agonists are also very interesting. The clinical trials with Anavex 273, and they had a combination between Anavex 273 and donepezil because we saw preclinically a synergy between the two compounds, are in progress in Australia. And we hope that they will validate this new strategy against Alzheimer's disease. In fact, targeting the sigma-1 protein in neurodegenerative pathologies, so I show you data on AD, but it's also worked in Parkinson's disease, ALS, MS. It's presently an extensive area of research by numerous laboratories. I would like to finish by thanking my colleagues in my team in Montpellier involving in the work. Some of them are moved to a company, Amilgen, that we have created, a service company, a CRO, that provides model of Alzheimer's disease and other pathologies for the pharma industry to test drugs. This work, of course, has been made possible thanks to Anavex and Alexandre Vamvakides and Christopher Misling. And I have also national and international collaboration with Teru Hayashi and Sungping Su at the NIDA in Baltimore, François Monet in Orsay in Paris, and Didier Morin and Romain Long in Créteil, also near Paris. Thank you very much. Yes?
I mean, it's very interesting work in terms of the neuroprotective effects, but just on the tau protein, I can just make a couple of comments. Tau phosphorylation is generally a non-specific cell stress marker.
Yeah, I totally agree.
So the reduction is simply a marker of reduction in stress, which goes with your story about, the neuroprotective effect. But it doesn't have an impact on the tau pathology as such.
Yeah.
The phosphorylation of tau is actually inhibitory to tau aggregation. It's probably a protective effect. And as I said in my talk, only about 5% of PHF tau is actually phosphorylated. So the effect is more of an effect on supporting your neuroprotective stress response elements rather than a direct effect on tau.
Yeah, I totally agree. The induction of tau phosphorylation and the generation of A-beta 42 we see in our model are clearly consequence of the toxicity we have with what we inject. So the fact that we have a protection as a consequence in terms of diminution of tau phosphorylation, diminution of generation of A-beta. But what could happen is that a neuroprotectant can protect some pathways and not the other. For example, tau phosphorylation, in my case, I'm sure, absolutely sure, it comes from activation of GSK3 beta, activation of DYRK1A, because we have inhibitors of this kinase that are protective in the model. But if you induce general inflammation, if you make animals drink Al aluminum chloride, you will see tau phosphorylation, you will see induction of A-beta. But what is important in this data is the fact that the protection is sufficiently wide that we also have protection on these markers. But clearly, if we want to say there is an effect on tau phosphorylation on tauopathy, we must look at tauopathy models. So we will use transgenic animals overexpressing mutated tau and this kind of models to look directly on beside the amyloid aspect on the tau aspects.
The other point, if I may, I want to ask, you're saying that donepezil is a selective sigma-1 agonist.
No, it's an agonist. It's not selective.
It actually induces the toxicity that you're describing.
No, in the model it blocks the toxicity. Yeah. Yeah. Other questions? Thank you very much.